So cardio-respiratory physiotherapy is a specialty, a subspecialty of physiotherapy where we primarily focus on the lungs and the heart. There's a lot of various different techniques that we use, but just to kind of bring it to like a day-to-day, everyday life level, it has a lot to do with breathlessness, has a lot to do with managing chronic conditions that affect the lungs and the heart. Also has a lot to do with things like surgeries that, again, affect the lungs and the heart. So it's a subspecialty. We work with lots of different patients, primarily kind of helping people get better through managing their breathlessness, managing their lungs, their heart, and just being able to achieve more. So people that will benefit from it, there's a big variety. So you would start with your typical chronic respiratory conditions, and that falls under the category of cardiorespiratory physiotherapy. So things like COPD, bronchiectasis, cystic fibrosis, pulmonary fibrosis will typically be seen by a cardiorespiratory physio. And if we go a little bit beyond that, it's also people that have had, for example, a surgery on the chest or surgery in the abdomen. Those will require a bit of a respiratory physio input because as you wake up from surgery, quite difficult to kind of move and cough and things that we kind of take for granted, coughing, clearing your chest, and keeping kind of what we call lung hygiene and keeping your lungs clean. Those kinds of things are where cardiorespiratory physio can help. So a lot of the techniques and sort of knowledge that goes into cardiorespiratory physiotherapy is general physio knowledge. So it's things like exercise and movement improves sort of various aspects of somebody's body and how they function. So we pick up on those techniques, the things that are common to physio, and then you kind of tailor these to the cardiorespiratory population. So if you think about somebody that gets very breathless, how are they going to be able to, get out of bed, wash and dress themselves, go to the kitchen, go to the toilet, go out for a walk or a run, on the background of a chronic condition, a respiratory condition? That's where we kind of bring in our specific techniques, things like, managing your breathlessness with engaging your sort of diaphragm, things like keeping your lungs clean. Some techniques look very different from what most people are used to. So we will tap and shake and do various things on the chest to help clear the lungs. So those are quite different. But at the end of the day, it does go down to, movement, pain-free empowerment, and the patient's feeling like they can, manage their condition, manage their symptoms. It will depend a bit on what the reason is for the visit, but generally you would have, we would check your oxygen, we'll check your blood pressure, check your heart rate, check your respiratory rate, so all these numbers that tell us how the lungs and heart are doing and how they're performing. We'll also have a listen of your chest with our stethoscope. That's our, the device that you see doctors having usually, but we do that too. So we'll assess, we'll listen to the lungs, listen to the air going in and out, and is it going in everywhere? Is there an area which is quiet? Do you have any extra sounds that shouldn't be there, and what does that mean? So you'll come in, we'll take all these numbers, listen to the chest, and then probably ask a whole bunch of questions, to be honest. So questions that have to do with, what is your breathlessness like? When does it happen? How often? What makes it better? What makes it worse? Questions that will help us understand the nature of the symptoms. And then on an initial assessment, again, it does depend, but typically what I'll try and do is find an activity that is the problematic one, the one that we really struggle with, and try to look at that one activity to begin with and just kind of break it down and find out where the issues lie. And then probably give anybody who comes and sees me, I do try to give them something in that initial assessment, a single technique, something that is useful for them to take away for that day, before we then kind of build up on that on later appointments. This can depend on the condition, but I'll answer this by saying what a cardiorespiratory physio can do for you is help you primarily maintain lung hygiene. So that means keeping your lungs clean, keeping them clean from sort of the risk of infections. So if you then kind of neglect that aspect or don't go into the techniques that help you keep your lung clean, the risk of infections can be a bit higher. And then that will kind of cascade onto breathlessness, which is usually the main symptom. And it's that feeling of, I can't get enough air in. That breathlessness is the defining thing. It's the one thing that really brings most people to the cardio-respiratory physio. And simple techniques can help somebody manage their breathlessness and be able to do the basic things that they want to do in life and the things that they enjoy. So, not addressing that can eventually mean that the breathlessness kind of gets worse and takes over aspects of your life. So booking an assessment with us, various ways. We can do it online, we can do it by telephone. We offer a sort of free telephone consultation to see, just to, sort of say hello, give me your brief history, and then I can tell you right then and there if the cardio-respiratory physio service is the right one for you. And then we can have a telephone call, we can kind of set up the appointment. For the initial appointment, there's no kind of specific requirement of what to bring in. What I try and do is assess somebody in a natural way, in a way that works for them. What I mean is, what is the condition, what is the activity that they most struggle with? And that's what I'm gonna focus on. So if you go out running, and you like running, but then you haven't been able to because of your breathlessness, come in your running gear, and that's what we're gonna do and assess. Or if it's a difficulty in sort of getting out of bed and all that, we'll use the beds in the clinic and we'll get out of bed, in and out, and practice those things. So it does depend, but there's no specific requirement for what anybody should bring. Just come in, we'll have a chat, and try to make you feel comfortable. Okay, so I know that a lot of people haven't really heard of cardio-respiratory physiotherapy, or maybe you don't know what exactly it is. Maybe you have a vague idea that, I have a bit of breathlessness. Maybe you have a condition. Maybe you're in for surgery, scheduled for any kind of, surgery around this area. If you're not sure, basically go to our website, have a look at the cardio-respiratory service, book a little call with me, and we'll have a chat. I'll let you know what we can do.